Hello, it's a great pleasure to be here with you. My name is Felipe Rocha and I'm from the University of Minho in Portugal. I will now present Families, Emotions, and Twice-Exceptionality, an overlooked dimension. I will start by contextualizing the main concept of this study. Twice-exceptionality consists of the coexistence of high abilities or giftedness and disabilities in the same individual. For example, a child may be very good in languages and memorization and very poor in logical thinking, as mathematics and geometry. However, sometimes a high ability can mask a disability, as well as a disability can cover a high ability. Let's suppose a child who is very good at languages may be excellent at writing a text, but may have great difficulty demonstrating this talent because he or she has enormous difficulty speaking in public. In this way, such child shall not show his or her talent and can be frustrated. Also, this condition can be accompanied of a pathology or not, depending on the perspective of the authors. Therefore, as it can be seen, it's a complex and misunderstood phenomenon, which may have distinct nuances depending on the authors. Thus, despite ingrained attention research, these individuals are frequently misidentified or partially understood, especially in educational contexts, because many professionals does not consider possible such coexistence of high abilities and disabilities in the same individual. This raises important questions about how twice exceptional children needs are identified and supported, not only cognitively, but also socio-emotionally. Based on this gap, this study asks, how are families and socio-emotional dimensions represented in the literature on twice exceptionality? Research on twice-exceptionality has predominantly focused on individual, cognitive, and school-based perspectives. While educational responses and diagnostic challenges have received increasing attention, the role of families and social-emotional dimensions remains relatively underexplored. This gap highlights the need to better understand how these aspects are represented in the literature. Well, this is a qualitative study based on documentary analysis. Documentary analysis is particularly suitable for examining how conceptual and interpretative frameworks are constructed in the literature. It allows for an in-depth and critical understanding of meanings rather than aiming for exhaustive or systematic coverage. The data consists of peer-reviewed articles from journals available via Sage. They were selected from an iterative reading process, in which inclusion was progressively refined based on conceptual relevance to exceptionality and alignment with the research question. Therefore, the study follows a phenomenological interpretative paradigm. Its focus is on meanings rather than statistical prevalence, and thematic categories were elaborated to organize and interpret the findings. The results shows that families occupy an ambivalent position. On one hand, they may act as protective environments, supporting emotional development and advocating for children's needs and children's rights. On the other hand, they may also be contexts of stress, uncertainty, and conflict. For example, due to friction with educators because of a lack of understanding of children's difficulty, parents cannot accept an educator feedback about a child's behavior or performance at class, or the educator may disconsider a parent recommendation about his child's need. Thus, there is evidence of diagnostic ambiguity and limited institutional support, reinforced also by a lack of specific policies. Therefore, this ambivalence shows that families can be both a source of support or a source of pressure. As a consequence of these difficulties, the literature suggests that self-efficacy and self-esteem may be at risk. These two cognitive structures can be underdeveloped, especially if they do not receive the proper support for such. According to Dabrowski's theory of emotional intensity, this has important implications for psychological development and long-term well-being. Thus, it highlights the importance of healthy emotional development in these individuals. It's a suitable theoretical framework for analyzing and discussing this finding, but I will not delve into it further. Continuing, social exclusion may also emerge as a consequence. This is often related to a lack of proper diagnosis, also vague policies and insufficient interventions strategies. For example, a twice-exceptional child may not have their needs adequately identified or supported, leading to missed developmental opportunities or exclusion from appropriate educational pathways and support systems. Identifying only high ability can prevent a disability from being properly addressed, or it may be expected to resolve itself. Although the literature indicates that identification of a deficit is much more common than a potential, and the child may miss opportunities for progress that can cause frustration for not having received complete support. Overall, social emotional needs tend to be overshadowed by deficit-oriented interpretations, partly because diagnosis often focuses mainly on deficits while ignoring potentialities. This reinforces emotional vulnerability, particularly during developmental transition. It clearly highlights the need for early identification and appropriate intervention, both for disabilities and potentialities, since both can affect the family and social emotional well being of twice exceptional children. Findings point to the need for more integrative and emotionally responsive frameworks across the lifespan, as well as support strategies. A recurring issue underlying these results is the presence of partial or deficit-oriented interpretations of twice-exceptionality, which may lead to misidentification and consequently to negative social-emotional outcomes. These are some references used in this study. You can take a picture or a screenshot now to consult them later. And this is my email address for further information about this work. Thank you very much for your attention.